We're talking about family now and the health and well-being of our loved ones as we age. Transitional care is an important thing to consider. Carol Lynn Richardson from PACE and Jody Malamas from Gap Care Solutions are here with more. Thank you both so much for being here.
Thank you.
This is such an important topic, and the first thing we're talking about is transitional care. Carol, you said it's like a buzzword.
It is. It's the new buzzword in healthcare. Healthcare can be confusing, especially for your seniors, moving from maybe hospital to home or hospital to skilled nursing facility. And the new transitional care buzzword is about a transitional care coordinator helping people through that difficult time.
Yeah, and Jody, you said it's very important because there's a lot of transitional services that can be provided.
Sure. Yeah, it's really important for continuity and coordination of care to happen during those transitions from healthcare setting to a different healthcare setting, or even from provider to provider. And the goal is always to help a patient be successful during those times, especially because our healthcare system is so fragmented.
And let's talk about some of the services that are provided during this transitional care.
So it's typically a medical professional, a social worker, a nurse practitioner, even a doctor, and really it's people knowledgeable of your health care, of your medical condition, your history, and their goal is to bring that information forward from one setting to another so that the clinical management is there.
And what about for the patient or for the patient's family? What does it look like to them receiving this transitional care?
Sure. It's familiarity, first of all. I think that as a transitional care provider is with them along through all settings, the whole continuum, from the acute, which is the hospital, to the subacute, which is the rehabilitation centers, even into the home, and sometimes even from the home into an assisted living. That familiarity helps them in terms of their anxieties and, again, bringing information forward.
Now, what have you seen with, I know there's different services, and we were talking about placement services too. What have you seen, though, with your experience? You have a lot of experience with this transitional care.
Well, I think that really people feel that it is so helpful because often they're leaving the hospitals, they don't know their treatment care plan, they don't know what to expect. So to have someone familiar to reiterate what they're working toward, what their goals are, and guide them and provide that education about their medical condition is so very important. It helps relieve anxieties and build them up for success.
Well, yeah, and just hearing you talk, I'm like, okay, transitional services, very important. We need to have them. For people out there, Carol, who are planning, if they want to learn more about transitional care and how to find services, what do you tell them?
I would say to call a PACE care coordinator. We are aware of transitional care companies out in the community that we can link them with, make sure that they're getting the proper people to come and give them the help they need.
Yeah, and the information they need too. And we were talking about PACE because you provide, of course, support services. You can talk to them by phone, you can talk to them online, and you also have the magazine that you can look through that has a lot of information about these services.
Absolutely. All the education they need in healthcare services is provided. Providers that are in the community, trusted providers that we believe in, we can help coordinate.
All right. Thank you both so much for being here. Again, it's PACE Magazine. You can get a copy of that. You can also learn more about transitional services, senior living, and more by going to seniorhousing.org or just call the number on your screen.